Hi, I'm Julia, and for our final task, I'm going to show you how to insert a chest tube. So first things first, whether it's in the trauma bay or at the bedside, you want to sterilize your patient, either chlorhexidine, betadine, whatever. Drape them, go ahead and get yourself sterile, or as best you can, at least sterile gloves. Make sure you have your equipment ready. Things we need, a Kelly clamp, i.e. curved 6, a scalpel, we have a 10 blade here, a needle driver with a large suture, we have Maxon here on a large needle, as well as your chest tube, in this case 36 French. You can have other accessories like hemostat if you need them, but they're not necessary. So I'm going to palpate landmarks. I've prepped a really large area so I can do this. I'm going to go to the angled, the sternal angle, which is roughly the second intercostal space. I'm going to march that out. And then I'm going to go down to about the 4th intercostal space. You want to insert this either 4th or 5th. First thing you're going to do is decide which one, and since this is a mannequin, we already have one at the 4th, I'm going to insert one at the 5th intercostal space. I'm going to take my lidocaine. If I have time to do this, it saves the patient a lot of pain. Inject, make a wheel at the skin, go a little further in, actually hit the periosteum over the rib, inject there, and slip right past it, right over it, to inject a little bit into the pleural space. Pull out, get rid of my sharps. Next thing I'm going to do is, if I'm aiming here for the 5th intercostal space, I go directly below it to the rib, the 6th rib, and at the inferior margin of the 6th rib, I take my scalpel, trying not to pull my suture and contaminate everything. And at the inferior border of the 6th rib, I make a 2 to 3 centimeter superficial incision. Once I have that, I take my Kelly and I just bluntly dissect, either with my finger or the Kelly, bluntly dissect until I can feel the top surface of the rib. Once I'm on top of the rib, I push the Kelly superiorly and then change the angle so that I'm actually perpendicular and facing the pleural space. And right now I've got nothing between the Kelly and the pleural space. So at this point I'm going to use a little bit of force to actually get it into the pleural space. It's important to use a two-handed technique to make sure you don't pop through and damage something vital. So you go ahead and you push. My assistant's going to stabilize for me, the mannequin. And once I'm in, I go ahead and open up. You can pull back just a little bit to actually stretch the pleura. I can try with my finger to find that hole right there. Do a little stretching in one direction and the other. Some people just like to stretch it with their hand, which works just as well. Again, using my finger as a guide, I try to get back into that same space. Stretch. Okay. Once I know that I feel around, making sure there's no actual adhesions. Once I'm sure there are no adhesions, I go ahead and take my chest tube, which has been loaded onto another Kelly. Notice the tips of my Kelly do not protrude past the chest tube so that there's no injury. I go ahead and, using my finger as a guide, feeling at the same time the rib laterally to my finger, go ahead and put the chest tube in. Once I'm sure it's in, I can withdraw my finger, change the angle, release the Kelly clamp. I advance the chest tube far enough so that this hole, the last radio-opaque marker, is all the way within the pleural cavity. It'll be different lengths on different chest tubes of different makers. Once I'm sure it's there, I need to secure it. So I take my large stitch, and I'm going to do a U-stitch. If it's a large hole, I'd first secure and close off some of that redundant space. But in this case, for the sake of time, just show you the U-stitch. So you go in on one side, you can take it in two. There's one. to pull about halfway. I asked my assistant, please hold this back for me. Load my needle driver backwards and do the stitch in the other direction. Again, since I made kind of a gaping huge hole here, I'm going to take it in two. You can do it in one, doesn't matter. Pull it through. I'm going to ask my assistant to take the needle off, needle down. Okay. First, going to go ahead and throw one suture down, cinching, and then I'm going to wrap around my tube like I would a drain stitch, being sure to cinch down every once in a while so that it stays tight. You can let go if it's comfortable for you, Hans, thanks. And once I've got a couple of them, go ahead and throw in some knots. In real life, it might be as slippery as this is, but whatever. And you get the idea. And that's how you put in a chest.